Welcome to episode 2 on my smile design principles. I'm Dr. Todd Snyder. As dentists, we often want to have perfection and utilize various protocols. Now, these small episodes are intended to help you quickly evaluate your patient's face and smile for various types of cosmetic dental procedures. Now in step 2, we're going to start to evaluate the smile and how it fits into the entire face and overall appearance. Again, I feel it's best to utilize full face photographs for the assessment. I'm evaluating lip symmetry and position when the patient's smiling. I'm looking at the lips because they're the frame that houses that beautiful smile. And if we're to create a beautiful new appearance with the teeth, we want the frame to be as nice as possible. So we're evaluating if the lips are symmetric and do the teeth interfere with the smile. Now we're also looking at tooth display and gingival display within the frame of the smile. Now think broad generalization at this point for this exercise. Don't try to measure tooth size or gum display yet. We're evaluating the smile from a global view and how it makes us feel and where it has obvious and or not so obvious problems. So here's a trick to evaluate the appearance and its symmetry. Now, no one's perfectly symmetric, but yet we can all still look amazing. And I think slight asymmetries are more desirable than being perfectly symmetric, as it looks kind of artificial. Now, notice on this woman, she's very attractive and she looks very symmetric, doesn't she? And part of my TS system, inside of my live and online training programs, I use a tool or technique which I call the split image reflection technique. So I want a quick way to assess a patient's face and smile. So here's the first part of the technique. I take an initial full face photograph and then I flip it on the vertical axis in my software. Okay? So in doing so, you can instantly see the opposite image, and you can start to see some of the asymmetries in her face, some of the discrepancies. Patients don't obviously see their own discrepancies, they blocked it out. But when they see these, they start to recognize things they hadn't seen before. Okay? So this is exposing the patient to imperfections and removing the cognitive mapping that our brain implements. You'll notice this in other cases, as the hair sometimes makes things look more asymmetric when it's not really the hair, it's sometimes the face, but yet we can't see it. So now let's use the split image reflection technique to evaluate tooth position, bone, and arch symmetry. So I cut her photo in half and I flip the left image so that I have the exact same image flipped on a vertical axis and then pushed together to create a new appearance. Based on doing this, we'll typically see the face having deficiencies or excess where we're looking at the smile and the rest of her appearance globally. Now notice how small her face starts to look, how narrow it becomes. So she's not truly symmetric. We know just by flipping the image and putting it together, we know she's not symmetric. We can see that her face looks smaller. Now her smile became smaller. Is the smile more or less desirable to the patient? It allows us to see where we have deficiencies and where they're present, so we can contrast that to her original image. Now next, we take the original image and we take the opposite half and flip it. And what we find is now the face in this case got larger and the smile got broader or wider. And so now we again can talk about the appearance and which do we like better. Do we like a broader smile? Do we like a narrower smile? Do we like the symmetry of this smile versus the symmetry of the previous smile? So again, we've created a symmetric appearance by using one half of the face when it's flipped on its mirror image. Based on this, the patient's again perfectly symmetric, and we can now start to assess the appearance of the whole face and or the smile. Again, is the smile more or less desirable to the patient? We can see now the patient, when they smile on the left side, is substantially longer and more visible in her smile, yet it wasn't obvious initially. So again, don't look at the whole face as much as we're looking at the smile, but one of the smiles will often be more desirable. Okay? So even though they're looking at all this other things happening in their face, we want to look at the smile. Now we can also zoom in obviously to just evaluate the smile if the patient is distracted by the entire face. So this process should help you and the patient to more easily see areas within the smile that you like or that need improvement. So that's all for now. Stay tuned for the next episode.